I grew up in Fremont, Ohio. I finished my undergraduate at Ohio State University, and I did my dentistry at Ohio State University. And from there, I came to Toledo, Ohio, because I grew up in Fremont. I wanted to be closer to home, and I'm really happy to be in Toledo for the last 20 years. My interests lay in reconstructing a patient's bite and their function. And I do that with various ways. One is with crown and bridge, which is good old techniques with removable dentures. But what I really love are implants. One of the technologies that we have added is CBCT. It's a cone beam CT scan. And that allows us to see a patient's image three-dimensionally, so we can keep our patients safe and we know where their vital structures are, and it allows us to place our implants with pinpoint precision. Anybody who's missing a single tooth or they're missing all of their teeth are candidates for implants. Implants are life-changing procedure, and I can say that because I have had experiences with many patients who have come to me at various stages of their lives, and I have seen the transformation from a young girl who, once you fix her smile where she can smile confidently, I've seen a transformation where they all of a sudden are interested in the way they look, and they wear makeup and they do their hair and wear better clothes and have gotten better jobs, to elderly who are really miserable with poor fitting dentures, and we can just put as simple as 2 implants in or 4 to secure a denture, and it just makes a tremendous difference in their lives. So at this point, we have completed our crown preparation, and this tooth is going to receive a crown. Normally, at this stage, we take an impression and send it out to a lab and wait a couple of weeks and put a temporary crown on here. However, with the CEREC technology, what we can do is do a direct optical scan in the mouth. It's a digital image. It's a 3-dimensional image, and it's more accurate than an impression. So now Deanna's evaluating her optical impression to make sure she's satisfied with it. Well, today we got a chance to see scanning of a preparation in the mouth. It's a very accurate procedure, and my hygienist, Deanna, actually was able to design it. Then I'm the one who approves the design, and once the design is approved, it goes to the milling unit and gets milled. So now we are looking at our milling chamber. The crown that was designed in the operatory is now wirelessly sent to the milling chamber. Once this block undergoes firing, it is going to be very hard, so that a patient can chew on this and not be afraid of fracturing it. What we haven't seen is that crown that comes out of the milling unit is going to go into a porcelain oven. Once a patient comes in and they may be a candidate for an implant, first we want to review their medical history. If we need to secure any consultations from various physicians and need to alter some medications, we will first get the permission from the physician that we need to alter some of the medications that you have been prescribing them, or we may ask the physician to clear this patient for advanced dental surgery because we don't want to jeopardize our patients. First of all, we want to keep our patients safe. Second, we look at the bone level and we look at how much tooth structure we have, what the bite is like, and we want to discuss it all because we don't want it to be a surprise later. Telling Mrs. Jones, we thought we could put an implant here that will look really nice, but we have to maybe make it a little short or angulate it wrong. We want to know these things ahead of time. So what we actually do is we digitally place the implant in the software, and with the CIRAC that you saw, we actually scan the mouth and correlate both of the data so we know that, yes, when we put an implant here, this is what we expect the tooth to look like at the end. Because patient doesn't really care what's under the gums. They want above the gums to look natural. When you can place an implant and make it look natural and have it function naturally, and patients come back and say, "Doctor, that's the best tooth I have," and that makes you feel really good.